My name is Dr. Sophia Davis. I am the foot and ankle surgeon at Orlando Orthopaedic Center, and today I'm going to talk a little bit about flat foot reconstruction. A lot of people believe that just because you have flat feet, you need reconstructive surgery. This is actually not the case. The only time you need any kind of surgery or non-operative treatment for flat feet is if you have pain. If your feet are painless, you don't need anything to make them less painful. That being said, if you do happen to have significant discomfort from having a flat foot condition, there's several different treatments options. Some of them include inserts for your shoes. Others include ankle bracing, which can decrease the discomfort. Ultimately, if these modalities fail to adequately control your pain, then we would move on to surgical options. One of those options is a flat foot reconstruction. Essentially, what happens when you develop a flat foot is your heel bone goes out to the outside portion of your foot and your arch collapses. So reconstructive options include shifting your heel bone over and then doing a tendon transfer to replace the tendon that's no longer functioning in your foot. Other options, if you develop significant arthritis along with the flat foot, would be a fusion type procedure, and those would include fusing a few of the joints in your foot, basically positioning the foot in a good position and then fusing those joints. You would maintain your ankle range of motion, so you would still be able to move your foot up and down. As far as recovery periods, both recovery periods are very similar. You would be in a splint for a couple weeks until your stitches came out, and then potentially in a cast or a walking boot for another 4 to 5 weeks after that, and then eventually allowed to weight bear probably at about the 6 to 8 week mark, depending on how the bones were healing, and finally coming out of the boot at about the 3-month mark. We would also start some motion at the 6 week to 8 week mark as well.